I always try to remind women that are often frustrated with infertility that, the men have to sort of put up, and find out what their situation is. And a lot of times, thank God, not plenty times, but every once in a while, a cancer will be part of the reason why. So if we can dive into this graphic about men.
Yeah, so again, men are considered infertile if, for example, the testicles that cannot make sperm. Let's say we have used chemotherapy. I guess we're going to go later on into it. And then we have altered the sperm formation in those testicles, then certainly we're going to be having an infertility issue.
Exactly.
Or, for example, the passage of sperm from damage or blocked channels, for example, from surgery or radiation, and then direct injury to the sperm itself. So yes, I think assuming that a female is the one infertile because she underwent treatment, I think is a wrong assumption. This needs to be approached.
What's sort of the percentage of, just speaking about infertility in general, Elina, maybe you can chime in, like men, I tend to say, maybe I'm wrong, about 20% of the time, am I right in saying that to my patients? Just speaking generally infertility, in other words, the men may be contributing to the infertile situation about 20% of the time, is that correct, or am I off?
I think the general population, at least I can only speak for our Cancer Institute and our patients that we see, we always encourage a couple's consultation. If the male is affected, we always encourage the female partner to be present, or vice versa. Because if you're going to go through with a procedure to preserve any fertility, you want to make sure that both parties, if there's a couple involved, of course, have the ability to have a child in the future. So you don't want to go through a very kind of time-intensive commitment and then later find out that together you're not able to successfully achieve a pregnancy or a viable embryo. So we always encourage couples counseling when I at least educate the patients, and of course when the referral to the reproductive endocrinologist is made, we encourage that the pair go together.